Hey everybody, Dr. Schultz with the Centeno-Schultz Clinic with another weekly update. Thank you so much for checking in. Today we're going to be talking about what in the world is a shoulder labral tear. So thank you for checking in. It's hard to believe it's the summer of 2024. The goals of this brief presentation are to review the anatomy of the shoulder. What exactly is a labrum in the shoulder? What's the function of a shoulder labrum? And what are the different types? So as you can recall, the shoulder is basically a ball socket joint. That's right, a ball socket. So the humeral head is here, that forms the ball, and here's the socket. Again, it's just a ball socket. And the terms for this anatomy are a glenoid fossa. That is the socket. So you can see here's another depiction. Here is the humeral head removed, and here is the socket. Again, the shoulder is a ball socket. Here's another depiction of the bony socket that the humeral head fits into. Now, the shoulder is an amazing joint. It has lots of range of motion and can do amazing things for you. However, to do that, it has to be a shallow socket, and that is what's depicted here. It's not very deep, and that's what allows the shoulder to do the amazing things. So again, the shoulder is a ball socket joint. The ball is formed by the humerus. The socket is created by the glenoid or glenoid fossa. So the labrum is basically a ring of fibrocartilage that sits on the glenoid. There it is. And here's another depiction. And it's attached right to it. And what it does is it deepens the socket in the shoulder. It also provides an attachment for the ligaments, the biceps tendon, and in doing so, it creates major stability for the shoulder. Now, don't be put off because there's a labrum in the shoulder that I'm going to be talking about, but there's also a labrum in the hip. So please don't be confused. Now, labral tears, like everything in medicines, they are classified and graded. But I'm going to make this pretty simple today. So this is a view of the glenoid fossa with the labrum superimposed. And basically, tears of the shoulder labrum are divided mid-glenoid. So there are tears above the mid portion and there are tears below. It's that simple. So the tears above the mid portion are called superior labral anterior to posterior tears, otherwise known as a slap tear. And one is depicted right here. It's in the superior portion. It can start all the way in the front. It can go all the way to the back. But again, it's mid portion and above in the glenoid. And it involves, a slap tear involves the attachment of the bicep. Now, those tears below the mid portion of the glenoid fossa are called the Bankart. And it is involved with tears here, and oftentimes the labrum separates from the bony glenoid. So, in summary, the labrum is a piece of fibrocartilage. It sits in the glenoid fossa. It does so to provide a deeper socket and attachments for ligaments and tendons. It provides critical stability. There are entire classifications of tears in the labrum, in the shoulder. It's easiest to divide them as a midpoint of the glenoid. Those above are called slap tears, superior labral anterior posterior. Those below are the Bankart. I hope this was helpful. It can be a complex topic, but if you or a loved one are suffering from shoulder problems, consider a consultation from the Centeno-Schultz Clinic. We are experts in the evaluation and treatment of shoulder injuries. There are board-certified, fellowship-trained physicians. We have customized PRP and bone marrow concentrate treatment options. Most importantly, all procedures are performed under X-ray or ultrasound to ensure the PRP or the bone marrow gets to the targeted area. Thank you so much for checking in. We'll see you next week.